Okay, now we're going to do the central line dressing change. It is a sterile procedure. We have a triple lumen here that we are going to change this dressing on. So the first thing I should do, of course, is explain it to my patient, and then I'm going to position my patient. We should raise the head to where they're in a semi-Fowler's position, high enough that I can work on this and have a clear shot. Then when I come here, I come with my kit, a mask for the patient, and a pair of clean gloves. The mask for the patient I'm going to put on right now, and I'm going to explain to my patients that they have to have this mask on to keep them from breathing on the site when I pull the old dressing off. Okay, so with the mask on, I'm going to ask my patient to turn their head away from the site. Then I'm going to bring this closer to me here. I will open my kit, and it says open right here on the corner, and I will pull this away just like any sterile package away from it. I don't have to pull that completely off. I can tuck that around there and have that ready. So what I want to do now is I want to reach in there and pinch out those sterile gloves without touching anything else in there. So I can put those to the side. Then I want that mask, because that mask is my mask. So I want to carefully pinch it out without touching anything or letting anything come out of there. I will take that out and say it is contaminated. Now I'm going to put my mask on. Making sure I pull this around the bottom of my chin to make sure it doesn't slide up on my face. Now that I've got that, I'm going to put a pair of gloves on. These are just clean gloves, regular gloves, so that I can remove the old dressing. Here, you just start peeling this off and peeling toward the catheter. We can use some alcohol pads, even some hand gel, just to loosen this up a little bit so that it's not so painful for the patient. Once I've got that good and loose, then I'm going to pull it off the site and take this, ball it up, and throw these out. Here, I'm going to go ahead and inspect my site for any signs or symptoms of infection, redness, swelling, discharge, anything of the sort of that. I see that it is clear and it looks fine. So now I'm going to put my sterile gloves on. First one, of course, pinch that cuff. Next one, put my fingers up under the cuff to protect my fingers, and making sure my thumb is up and out of the way. Now, when you go through your kit, the one thing that fell out on me and is contaminated is something that we don't use anyway. So we can go through this and touching this now. This is sterile. We may end up using this if there's any kind of cleaning or drying that we need to do there. So we can put this to the side. The tape we may use a little bit later. This is your ChloraPrep device. This is an alcohol swab, one single stick of swab in there. This is used for pre-cleaning. So if I wanted to pre-clean my site with my alcohol pad, I could open this, take the swab out, and pre-clean the site. Then throwing this all away. Then I would take my ChloraPrep and I'm going to pinch these two together until I hear that vial in there crack. Then it's going to soak the gauze with the ChloraPrep or the chlorhexidine. And with this soaked, now I'm going to scrub for 30 seconds vigorously, back and forth, making sure I clean the site, a good swath all the way around, back and forth for 30 seconds. And once I'm done there, then I will throw that away. And now I'm going to sit patiently and wait for it to dry on its own. It is important that chlorhexidine dry by itself, air dry. So you can't dab that, you can't wipe it. Let it air dry. That's what kills the bacteria. So after about 2 minutes, then it is dry. Then you take in here, pull out your dressing. And the dressing looks like this. And it has a back on it. And this is the front. So when you peel this apart, this is the adhesive side inside. It's sticky. So when you pull this off, make sure you don't stick that to something and throw that aside. Then you're going to make a taco so that you can kind of put your finger right there on the outside and put that right over the center of the site. Here is my site, so then I want to spread it out from there. And flatten it out, getting the air out from underneath it. Then there's a little split right here. That you just start peeling that outside border off. Making sure it's flat. Now, here, the sterile part of the procedure is done. So I can have my patient relax. We can take the mask off of them. And I can take my gloves off. And my mask off. Because now what I want to do is take a pen and write today's date, the time that I changed this, and my initials. Because these are good for 72 hours, so they have to be changed every 72 hours or when they become loose. I'll put that to the side to make sure I don't interfere with the site, and I will make my patient comfortable. And that's a central line dressing change.